Hello everyone, this is Lady T and I'm back with another video. I have recently changed my channel from Lady T in Life to Living with Lymphedema. And I wanted to share my journey in having lymphedema because a lot of people ask me questions about what is lymphedema. So in this video I will be explaining about lymphedema, what it is, the causes, the treatments, and everything. In the picture you see legs, and you see different sizes and swelling. And I have lymphedema in both of my legs. Some people have it in their arms, some people have it hands, stomach. It can be anywhere, I have a little bit in my stomach, but it can be anywhere. Lymphedema is the buildup of lymph fluid in the fatty tissues just under your skin. This buildup might cause swelling and discomfort, and it can also be painful. If you look in the diagram, it's a blockage. It shows a picture of the blockage of the lymph vessel and the fluid retention, and the blockage causes the swelling. What happens is the lymphatic system is a part of your immune system. It moves fluid through your body, picking up waste, bacteria, and viruses. Your lymph nodes filter out the waste and flush it from your body. When something goes wrong, fluid backs up in your tissue. Your lymph nodes got damaged and vessels get blocked. Lymphedema can also happen without a clear reason. And dealing with this, with lymphedema and the lymphatic system, is very important to know when swelling is coming up, because some people just think it's regular fluid. In lymphedema, you either have it primary or secondary. I have it primary, which primary is a genetic inherited condition that can be developed at birth or later in life. People with primary lymphedema have a deficiency in the development of their lymphatic system. So I suffered it from birth, but it did not form up until 16 when I had my daughter. That's when it started to show. And secondary is developed when there is permanent damage to the lymphatic system. Often occurs from cancer treatments, trauma, injury, or infection. Can be caused by surgery, radiation, trauma, cancer, and infection. There are 6 things to do to help manage lymphedema: light exercise, therapeutic massage, regular skin cleaning and moisturizing, elevating the affected limbs, compression garments, and weight maintenance. Those are important things to be able to manage lymphedema. In lymphedema, treatment can help, but the condition cannot be cured. It requires a medical diagnosis, and chronic can last for years or even be lifelong. In my case, mine is lifelong. And with lifelong, it be painful a lot, but you have to learn how to manage your condition to keep the swelling under control, because it's easy for it to get out of control. And it's also good to educate yourself in lymphedema, because a lot of doctors do not know about lymphedema. I'm currently in the hospital now, and I had to tell them that I have to be wrapped, and things have to be done to manage my lymphedema. So education yourself and learning about your condition, it helps you to move forward and have a healthy life. You're not going to be able to do things like everybody else do it, but you'll be able to manage it so you can enjoy life. One other treatment is bandaging. And with bandaging, you have to make sure you get the bandage that compress, the right one, because there's so many bandages out there, but the one that compress your leg so the fluid can move towards your torso. Pressure also stops the building of it. When you swell up and you wrapping it, and you see in the picture up there how they wrap it, it draws the fluid upward and it goes down. And therapists will teach you how to do that, or a family member how to manage it and help you keep your lymphedema under control so you can be able to do things. But with lymphedema, you will always have to have that or compression stockings, and you'll start off with bandages, and they get as small as they can, and then they will measure your leg so you can get compression bound stockings So you can, go places, do things, and walk and exercise like everybody else. In this picture, this is on legs. The before is with the lymphedema swole up, and then after you get wrapped, that's how your legs will go. They'll get you down as small as you can and compress it. And this is all after you are wrapped up. And some people it takes a little longer or just to be wrapped to get to that point, and some don't take that long. It all depends on that person's body. Another treatment is light exercise. Physical activity encourages the fluid to drain into the lymphatic system in the abdomen. Walking, swimming, yoga, all those help encourage the lymph fluid to move. First, you have to get clearance from your healthcare provider that it's okay to begin exercising. Exercise should be low intensity, pain-free, within the guidelines if you had surgical procedures done while wearing compression bandages or garments. The exercise should be stretching to increase the range of motion of your joints that are tight, strengthening to improve your muscle performance and strength. Endurance to improve the efficiency of the heart, lungs, and muscles. Another treatment is therapeutic massage. A trained professional rubs and taps and strokes your body to try to move the fluid away from the swollen area. And you can also learn how to do it yourself. And it has to be a physical therapy with special training as a certified in lymphedema. And it actually is relaxing. It loosens your skin and it moves the fluid to the area so it can drain in your body and come out. It feels really good and it's really stress free. And this is some equipment that uses the pumps. And it's good to pump your leg. I have this one right here. And I pump my leg like an hour a day. And it just moves the fluid, soften and keep your lymphedema managed. And this is another kind of, it's many different kinds of equipment that you can use to manage your lymphedema and control it. Also with lymphedema, you want to avoid infections, prevent cuts, scratches, to infect the area that with them tiny little injuries can cause infection in your tissue and allow bacteria to grow. And it can become serious real quick. And if your skin is red, you got chills, fevers, it's important to call the doctor. Or the pain get worse, or flu-like symptom, call the doctor and check me. I know the symptoms, and I go to the emergency room. I know when to go, and every time I go, they say I do got it, and I'm inside a hospital, which I am currently now. And I get treatment through the IV, and then once you get better, you get treatment oral and from the infections. Thanks for watching this video. And this is my first video talking about what is lymphedema and my journey of lymphedema. So remember to like, comment, and subscribe. Hit the notification bell to follow my journey with living with lymphedema. And I'm going to have videos of me getting my treatment, exercising, the food I eat, and the diet is very important with my journey with lymphedema. So stay tuned for more videos and my life as living with lymphedema.